we good? Good? Okay, great. Good afternoon, everybody. Sorry we're running a little bit late today. Today is Tuesday, April the 28th. I'm Dr. Val Arkush, Chair of the Montgomery County Board of Commissioners. I am here with my fellow commissioners, Vice Chair Ken Lawrence and Commissioner Joe Gale, Dr. Al Wong, Regional EMS Director, and Dr. Brenda Weiss, Administrator for our Office of Public Health. Since our April 27th press briefing, we have had 182 new positive cases of COVID-19 in Montgomery County. Now, one note about that number, that includes 119 of the inmates at the Montgomery County Correctional Facility that tested positive, and also 11 of the staff from the correctional facility that did test positive. So this brings us to a total of 3,865 individuals that have tested positive for COVID-19 in Montgomery County. These individuals are from 27 municipalities, none of which are reporting their first case, so this keeps us to 61 of our 62 municipalities. These individuals range in age from 19 years old to 99 years old. As always, you can check our map at moncopa.org/COVID-19 for the age breakdown in each municipality. It's both age breakdown and municipalities. So we have one person who is between 10 and 19, 53 people between 20 and 29, 48 individuals between 30 and 39, 22 between 40 and 49, 30 individuals between 50 and 59, 13 between 60 and 69, 6 between 70 and 79, 7 between 80 and 89, and 2 between 90 and 99. There are 29 females and 153 males. 3 are hospitalized, 4 are at home in isolation, and we do not have information about 175. I'm also saddened to confirm that 13 more Montgomery County residents have lost their lives to COVID-19, which brings us to a total of 233 deaths confirmed positive from COVID-19. 5 of those individuals passed away in a hospital, 4 in their residence, and 4 we do not have information on. They ranged in age from 65 to 98, and in total, 118 females and 115 males have lost their lives to COVID-19. We have, in terms of self-reported race, 12 Asian, 2 Asian Indian, 3 Asian Korean, 28 African American or Black, 85 white, and 103 who we do not have information on. Now, in terms of probable deaths, and as a reminder, these are individuals who have had COVID-19 listed on their death certificate as the cause of death, but we currently do not have a lab test that confirms that, and in some cases we may never get that lab test. So in total, we have 112 probable deaths. Adding that to our 233 confirmed gives us a total of 345 confirmed or probable deaths of Montgomery County residents from COVID-19. Our hospital situation is relatively unchanged. Just as a reminder, and I gave this information yesterday, on March the 23rd, Montgomery County hospitals reported approximately 15 COVID-19 patients in the hospital, with 4 requiring a ventilator. And now, 5 weeks later, we have over 400 COVID-19 patients hospitalized and approximately 100 requiring ventilators. So just a reminder how important it is to continue to practice social distancing and to continue to make only the most necessary trips. We are by no means on the other side of this yet, and your actions staying home have kept our hospitals functional, and we need to ask you to please continue to do that. Today's long-term care facility update, we now have 90 facilities that are reporting positive cases of COVID-19 among their staff and residents. Today we have reporting from long-term care facilities and other congregate care facilities that brings us to 1,037 cases among residents and 427 among staff, for a total of 1,464. Another reminder, not all of these individuals are Montgomery County residents, so these numbers won't add up into the numbers I presented earlier, but we are tracking these cases and making you aware of the very serious and very challenging situation faced by many of our long-term care facilities. Our field assessment and support team, our FAST team, has now completed 15 visits to 15 different facilities. They spent today debriefing and also training some additional individuals to be part of more FAST teams, and they will be heading out tomorrow to visit some of the more impacted locations. On these visits, we are recommending that every facility conduct complete testing of every one of their residents and every one of their staff so they can get a better handle on the situation in their respective facilities. We're also reviewing infection control policies, making sure that, doing our best to make sure that they're using personal protective equipment appropriately, answering any questions that they have of us, sharing best practices. We are just simply there to help in any way that we can. We continue at this point to have 12 12 long-term care facilities that are participating in our partnership with real-time medical systems monitoring. From those 12 facilities, we are able to pull anonymous data to help us with trend analysis and hopefully work as kind of an early warning system and help to identify places where we might be able to offer some help in real time and ahead of the curve. That would be the goal with this. And we again want to thank Real-Time Medical Systems Monitoring for donating this service to us during this pandemic. Today's update on the Montgomery County Correctional Facility. As you may know by now, last Thursday and Friday, over a 48-hour period, we tested with the assistance of Prime Care Medical, who provides our medical services there. We tested every inmate and every staff person in the facility. So I have today more results for you. We have now tested 942 inmates, and we have received all 942 tests back. We have 171 inmates that are positive, so that is 18% of the population. We have tested 307 Montgomery County Correctional Facility staff, 61 staff from Prime Care. We've received results back on 337. We're awaiting test results on 17. Of the test results that we've gotten back, 15 correctional facility staff are positive and 2 Prime Care staff are positive. I believe this information is current, none of those individuals were symptomatic. These are all asymptomatic individuals who have tested positive. We currently have 544 inmates in quarantine. Some inmates have moved to isolation because they tested positive. Other inmates have moved out of quarantine. They were in quarantine previously from other tested positive individuals, and some of those individuals we now know are negative and moved out of quarantine. So we currently have 544 individuals in quarantine, and we have, of course, the total of 175 inmates in isolation, meaning that they have tested positive. In addition to the 171 new individuals, we previously knew about 4 individuals that had tested positive and were already in isolation. So that is where we are with the correctional facility today. The Montgomery County Community College community-based testing site is open and running smoothly. I want to give thanks to the community college, to Whitpain Township and their police department, to the National Guard, and to the several county departments that are assisting. I also want to thank all the folks that are working at the Norristown Walk-Up community testing site. That site's located at the Delaware Valley Community Health Clinic, and I want to especially thank Dr. Scott McNeil, the president and CEO, and Dr. Julia DeJoseph, vice president and chief medical director there. They have been phenomenal partners in getting this walk-up clinic set up for residents of the municipality of Norristown. And individuals from Norristown who would like to get testing done there can call beginning at 8:30 tomorrow morning at 610-592-0680. That's 610-592-0680. And that is specifically to be tested at the walk-up site in Norristown, and this is for Norristown residents. The clinic actually does the testing between 11 a.m. and 1 p.m. You do not need a car. You do not need a doctor's note. You just need to make that appointment at the number that we told you about. And they'll be open Monday through Friday. Now, for the drive-through testing center, at this point, inclusive of the folks that we've already tested in Norristown, as well as the drive-through center, between April 16th and April 25th, we've tested 2,089 individuals. We've received results on 92% of them, which is 2,096. 317 of these individuals are positive. So that means for these first 10 days, we're running about 15% positive, and it's been pretty steady at that rate. The appointments for tomorrow, Wednesday, will open at 8 a.m. Wednesday. You can make an appointment at moncopa.org/COVID-19 under the green County Testing Information button, or you can call 610-631-3000 beginning at 8 a.m. Wednesday morning. So just a couple reminders about social distancing. We went through this chart yesterday, and we're going to do it again today, because I just want to remind people, even though the weather's starting to get a little bit warmer, how important it is to continue to stay home. So I mentioned that at our community testing site, we've been running about 15% positive, and that translates into about 36 people out of the 250 that we test at that site each day. If these 36 people had no social distancing, they just went out and lived their lives and did their thing, and no one around them was practicing social distancing, we would expect in a 5-day period that each one of those people would infect 2.5 people. One person, 5 days, 2.5 more people are infected, which means that over the 5-day period, those 36 people could infect 91 people in total. And if all of those folks showed up at our testing site 5 days from now and were tested, you would see the red line on that chart, which is a big jump up in the number of positive cases. That would give us a positivity rate of 36.5%, just that quickly in 5 days. Now, if those same 36 people who tested positive had practiced strict social distancing, they really stayed home, they didn't interact with anybody, didn't go on any trips, then they would infect in a 5-day period 0.6 of a person. And yes, I mean less than one person. And so that would lead to a total of 22.8 new infections 5 days from now. So if those people were part of the 250 that we tested 5 days from now, that would be a positivity rate of only 9%. And you would see the green arrow that's on this chart. That's how we actually start to bend this curve down. So we're pretty flat right now, which is great, but we're still too high. And so we need to start reducing the positivity rate of the people that are coming through our testing center by decreasing the total number of people that are infected. And there is only one way to do that, and that is to limit your social distancing. It's abundantly clear from our testing from the correctional facility, from the nursing homes that have done it, and from what we're reading in the scientific literature, that all kinds of people are walking around with the coronavirus without any symptoms, but they can transmit the virus. They are contagious. And so the best way that we can get a handle on this thing is for people to just stay home. And with that, I will turn over to Commissioner Lawrence.
Good afternoon. Previously, in another reality, today would have been primary day here in Montgomery County. As I hope you know, the primary has been moved to June 2nd due to the COVID-19 pandemic. So we do want to share some of the deadlines for you. If you want to register to vote or apply to vote by mail, you can do so at www.votespa.com. And the new deadlines are May 18th to register to vote. May 26th is the last day to apply for a no excuse mail-in ballot. And the deadline to return your voted mail-in ballot is June 2nd at 8 p.m. A plan to consolidate polling locations in Montgomery County is currently being finalized, and it will be announced as soon as it's approved by the PA Department of State and then the County Board of Elections. Voters will be informed by mail about polling location changes, and we will post all the changes as well. There will be significantly fewer polling locations than in a normal election. And with all these changes, I want to remind everyone that voters have the option to vote by mail using a mail-in ballot rather than going to a polling place. But the U.S. Postal Service has also informed us that normal mail is taking 4 to 6 days to arrive rather than the typical 2 to 3 days. So please take this into account if you are mailing in your registration, an application, or once you have your ballot, that it will take 4 to 6 days. Voter services is open from 8 a.m. to 4:30 p.m. And they will answer the phone and answer your questions at 610-278-3275, 610-278-3275, and that's for Montgomery County residents. And with that, I'll turn it over to Commissioner Joe Gale.
Good afternoon, everyone. I'm Montgomery County Commissioner Joe Gale. In times of crisis such as this, it is important that there be a combined effort from all levels of government towards a common goal of saving lives, reducing economic harm, and ultimately getting people back to their normal lives. Response and recovery efforts need to be federally supported, state managed, and locally executed. I often use these press conferences to let you know about county, state, and federal programs and initiatives that may help you get through these difficult times, such as unemployment compensation, economic impact payments, small business loans, and tax relief measures. However, the federal government is not only providing financial support to Pennsylvania, but also making sure that we have the personal protective equipment needed to protect our healthcare workers, our first responders, and other essential workers during this time. The Trump administration is coordinating Project Air Bridge, which is a public-private partnership designed to expedite the movement of critical supplies from other countries to the United States. This project partners with U.S. medical supply distributors to airlift personal protective equipment from foreign factories to the United States and reduces shipment times from weeks to days. Through Project Air Bridge, the federal government has supplied Pennsylvania entities with 628,000 N95 masks, 3.2 million surgical masks, 58,000 eye and face shields, 2.2 million surgical gowns, and 78.4 million surgical gloves. In addition to Project Air Bridge efforts, FEMA has also supplied Pennsylvania with equipment from the Strategic National Stockpile. Pennsylvania has received from the stockpile 365,000 N95 masks, 869,000 surgical masks, 6,500 medical gowns, 173,000 face shields, and 310,000 gloves. Montgomery County, Philadelphia, and the other counties in the southeast region of Pennsylvania are the hardest hit by the COVID-19 crisis. Therefore, these supplies will help us more than any other part of the state. I want to thank President Trump and our representatives in Congress for providing Pennsylvania and our community this personal protective equipment. By providing individuals and businesses the equipment and tools they need to protect themselves, we are able to slow the spread of the disease and hopefully get our Commonwealth reopened and back to work as soon and as safely as possible. Thank you, and I'll turn it back to Commissioner Arkush.
Okay, happy to take questions.
out that this was in China, and we were told dry cough, maybe sore throat. Is it 5 months? Are we 5 months now?
4.
4 months? Okay, even better, 4 months. And we were told symptoms are reiterated. Now we're being told it could be anywhere from dry cough to rash on your toes to possible strokes with no symptoms. Do you think we are ready to reopen given how little we know about the virus right now?
So the question is, 4 months ago,
4 months ago,
we were told that there were 3 primary symptoms of this disease, which was a dry cough, a fever, difficulty or short breathing or shortness of breath. And now we know that people are presenting in a lot of different ways with a lot of different symptoms. We've seen everything from loss of taste and smell to be a pretty unique and pretty distinctive symptom of this disease to some more recent news that is certainly very concerning, that this virus can cause in some people their clots to form, abnormal clots to form. Those clots can lead to strokes, to heart attacks, to pulmonary embolism. So the question was, is it time to open up? And right now, for us, as we've been discussing, we still have hospitals that are full. They do have some available beds, but not a lot of capacity for more surge. We still have a pretty steady number of cases. We are not seeing a dip in the number of cases. We've seen a plateau, but not a dip. And we still, despite receiving some assistance with PPE, I don't think there's a hospital worker in our region who would tell you that they aren't reusing their personal protective equipment. They're following the CDC guidelines to do that in a pandemic. They're doing it as safely as possible, but this is not how we would operate normally. We still have hospitals who have beds set up in non-typical locations, like the places where normally people would get outpatient chemotherapy or other units like that. So right here, right now, I believe we have a ways to go before we can start to open up in any traditional way of thinking about opening up, which is going back to any kind of normal. I hope that people will continue to practice social distancing. I know how frustrating it's getting. We have seen pictures from this past weekend about some stores that were not instituting social distancing practices in their stores. And I want to say there's a lot of stores who are doing it right. And so, as I mentioned yesterday, I hope you'll take your business to the stores that are doing it right. Vote with your feet and not patronize places that are doing it wrong, because they're just going to perpetuate this outbreak. We are not through this yet, and I hope everyone can just continue to hunker down and be patient, take personal responsibility for your actions, and if you do the right thing and everybody else does the right thing, we will get through this a whole lot quicker.
On that storefront, it's the big chains that are open. It's not the little mom and pop stores where people are picking up their gardening supplies and things like that. And that's really what people were doing if they weren't at Parks and Trails. They were out getting home improvement supplies. They were out getting gardening supplies. And it's the little guys that you're telling us to go to that aren't open.
Well, I'm not necessarily telling you to go there, but yeah.
I can tell you, I was out this weekend. I saw firsthand customers complaining they were waiting in line for an hour at a big box store to get packed close together.
Yeah. So the question was, or the comment was about observations this weekend about big box stores, particularly ones that sell garden supplies, being quite crowded and not enforcing any sort of social distancing within the store. From what I've seen, that it was absolutely the case. We have actually sent our solicitor out early this week to make some phone calls and send some letters to some of these locations, as well as some of the corporate managers for some of these locations. They truly are endangering the public right now. We are not ready for that in Montgomery County. The governor's orders are clear about social distancing for essential businesses that are allowed to be open, and we will do our best to point out to those stores when they are not following the rules.
But is there anything that can be done to enforce the follow the rules?
The governor has stated that they're not going to practice strict enforcement of these orders. We are taking it upon ourselves to have our solicitors notify them of what the actual rules are, and that we are in a public health emergency, and ask them to follow those rules.
This is just me checking my math here, I think. So you said 182 new cases today in Montgomery County. 119 of those cases are inmates. 11 are staff in the facility. And then when you were listing how many were in hospitals or where they were, just 100, did you say 175 were unknown?
Give me 1 second here. Correct, 175 unknown. The question was of the positives, how many were in hospitals versus not, or versus unknown.
But then if it's 182 and it's 175, we know where 119 are, right? I'm not going to say I was over the best.
So the, yeah.
I just wanted to make
So-
sure I got this right.
I just mentioned that of the 182, 119, so we do know where those 119 are. Yes, that's a fair point. Yes, we do know where, I believe we know where every one of them is. So, yes. We do know where the 119 are.
They weren't any of the ones that were, no, these are the ones that are in the prison. Okay. Got it.
When based on the data from the community-based testing site, you said you thought that the peak was April 5th and 6th, and talking then, you expected the hospital and fatality peak to kind of follow that by a set amount.
Couple weeks, yeah.
Is this what you expected to see? Is it playing out as you expected? Is it more? Is it less?
So the question is that at our community-based testing site, we saw a peak positivity around April 4th and 5th. On those days, we saw 24% of the people that we tested coming back positive, and we have not seen numbers like that since. And as we discussed, just with the course of this disease, people seem to often be home for several days, even a week, and feel like they're doing okay, and then they can suddenly take a turn for the worse. Other people, right out of the gate are pretty sick. So we did anticipate seeing, a couple week to 2 weeks after that peak positivity, increase in hospitalization, and we are starting to see that. I think we've, hopefully that's pretty much plateaued as far as we can tell. And the sense that we're getting from our hospitals is they're definitely more full than they were. But it does seem to be leveling off. And so then hopefully we're going to start to see that come down. And then the same thing with the deaths. Some of these individuals, we've had a number of people, as far as we can tell, hospitalized for 2-3 weeks. So we always have talked about from the very beginning that the number of deaths is a very lagging number. And we would expect, long after things have opened up, that we may still be seeing some deaths from this disease.
And yesterday you talked about the facilities where somebody would go, and you had a phrase for it, I don't remember exactly what it was, where they would go after they got out of the ICU or off a ventilator, and a concern about that being a bottleneck, and I kind of missed following up on that yesterday, but I wanted to ask more about that. Is there anything that or what is being done to kind of hopefully break that bottleneck, or what can be done to open those places up, or to give more opportunity for those?
So when an individual is who's been pretty ill, particularly for a period of time, they might be ready to be released from the hospital, but they may not be ready to actually go home. They might still need some assistance with various tasks or some physical therapy or occupational therapy, but not enough that they need to be in the hospital. So they might go to a subacute nursing facility. So we're starting to hear from some of our hospitals that some of those next step facilities or subacute facilities are pretty full. Maybe not necessarily full of patients, but maybe don't have their full staff complement available to care for patients because they might have staff that are COVID positive. So I don't want to overstate that it's a bottleneck right now. We don't at the county have any ability to influence those facilities. None of them are run by the county or regulated by the county. I was just really sharing information that I'd heard, but it's all part of the big picture that when we talk about protecting our hospital capacity and our hospital workers and our first responders, that this is a very tightly integrated system, and it's like pulling on the thread of a quilt. And so you know, there might be some space over here, but if the next step in the system is full, then things are going to back up potentially at the hospital, and that's going to back up into the community. So the goal remains that when you call 911, whether you call because you have COVID-19 or you call because you fell and broke your leg, that there will be an EMT or paramedic who can come and safely pick you up, and that there will be a hospital bed for you on the other end of that trip. And that we are still trying to preserve those goals. So far we've been able to do it because everyone in this county has worked so hard to stay home at great personal sacrifice. But we could quickly undo that. You know, if we have a lot of weekends like this past weekend, all the sacrifices that our small business owners have made, and all the parents that are trying to be teachers at home, and everybody else that's just completely upended their lives, all of those personal sacrifices could be for nothing, because we're just going to spike back up and be nowhere, frankly. So we cannot let up. It's not time yet.
In terms of supplies for the morgue, do you know how the county morgue is faring with supplies of other areas, and they are seeing some shortages, sadly, in things like body bags and PPE for the staff there?
Yeah. So the question is, how is our county morgue doing on supplies of like PPE and other equipment? We're okay for now. And we have also created, I think we talked about this a few days ago, there is a regional facility that's been created to provide additional capacity for morgues in our region should we need it.
Has that been needed yet?
It has been.
And can you talk about why that's needed? What is there, because people can't have services, because funeral homes can't? Do you know the answer to that?
I actually don't know the details of it. I think there's a similar sort of backlog, perhaps at the funeral directors' homes. Things are just, nothing's happening as quickly as it would normally, and we do have way more deaths than we would typically at this time of year.
Do you know if a family wanted to have a service, but they wanted to wait until they could all get together, is that something that might backlog the morgue, or is that?
I would imagine it could. I don't know. You'd have to talk to the nurse or the funeral homes. I don't know if they're willing to wait or how that's going. So that one I don't have an answer to. You'd have to check with some of those folks.
And then circling back to the prison, is there any reason to think that those tests are unreliable, or to question the results? I mean, just because it is so kind of shocking, obviously.
Yeah.
You know.
So the question is, do we have any concerns about the validity of the tests at the correctional facility? So no test is 100% accurate. There is not a single medical test, well, maybe one or two, but almost none, that are 100% accurate when you're testing for a disease like this. So the tests that we ran were what's called the PCR test. The inmates were swabbed, and the swabs went to a FDA-approved, highly respected lab. It's the lab that Prime Care Medical uses routinely, as do many other hospitals and other facilities. So this is a top-notch lab doing everything right as far as we know, and all the standard procedures for testing were followed. Could there be some false positives? In other words, a few people that actually don't have the disease but tested positive? Yes, it's possible. And could the other side of that be true? Yes, there could be some people that tested negative who are actually positive. And so we have started internal discussions. We don't have a plan yet, but are contemplating at some point in the future retesting the individuals that tested negative the first time, just to see where we're at. But we haven't made any decisions on that. And if we do it, we will let you know once we've done it.
And I think we touched on it, but I don't think I asked you directly. If that many people can be asymptomatic, and what does that tell you as a medical professional? What does that tell you about this virus?
So I think kind of you're asking me, was I surprised that that many people were asymptomatic, or what does it mean that many people could be?
Yeah, are you surprised? And the challenges, just
Yeah.
the challenges that it brings with, it kills this guy but doesn't show up in this guy.
So one of the things, as I mentioned earlier, that we've learned about this virus in 4 months is that, at least in this country, large numbers of people are walking around contagious, but they don't have any symptoms. the event that really got my attention on this was one I talked about maybe 10 days or so ago, which was the situation on the U.S. Theodore Roosevelt carrier, where 4,900 sailors were tested, a very young, healthy population. About 660 of them tested positive for COVID-19, and about 350 of those had no symptoms. And so when you see those kinds of numbers, I think we all have to pause and ask ourselves, as we did with our correctional facility, what facilities under our jurisdiction should we be asking this question? Are there a bunch of asymptomatic positive people in that place? And of course the answer for us was yes. I'm not the least bit surprised. This is why I wanted to test everybody. We are seeing the same thing in the handful of long-term care facilities that have gone ahead and tested all of their residents and their staff. They are seeing residents and staff who are testing positive, who have no symptoms. And this is why I say over and over, we need more tests. We need hundreds of thousands more tests. And we need the rapid tests so that we can know immediately if somebody is positive, so that we can put that person into isolation. We can do contact tracing and get those individuals into quarantine, and that will help us once and for all, hopefully, get a handle on this virus. If we were doing that and practicing social distancing, even with more businesses open, it doesn't mean that everything has to be completely shut down. But as things start to open, they have to open with really good, strict social mitigation, social distancing practices in place, but we have to have the testing on top of that. If we don't have the testing, it's like being a pilot flying a plane without radar at night on a moonless night. Like, we're just literally flying blind. And social distancing will help, but if asymptomatic people are coming to work every day, it's going to be hard to get a handle on this.
Do you have data specifically from the Norristown testing site, or is that all?
We have only the first 2 days back, so I want to wait till we have more because I don't want to inadvertently identify somebody.
So you don't have a percentage positive?
Not that I'm going to share right now. Yeah. Teresa?
Peter Cole from the Morning Call was asking, you recommended testing in all long-term care facilities. Can you provide more details on what plans you have and if anything's been implemented?
Well, I don't have any plans because I don't run any of these. I'm sorry. The question was, in the long-term care facilities, I've recommended that everybody test, and so then the question was, what plans do I have in place to do that testing? So unfortunately, I don't have any because the county doesn't run a single long-term care facility here in Montgomery County, and it is the state Department of Health that licenses and regulates these long-term care facilities. So what we're doing here in Montgomery County is sending in teams, and we are recommending that they test everybody. We have the ability to connect them to testing if they need help with that, but we don't have the ability to force them to test all their residents or mandate that they test all their residents. But it is our strong suggestion that they do so for all the reasons that we've been discussing, because it's quite likely if they have a single case in their institution, there are almost certainly a number of people who are also positive but don't have any symptoms.
Janet Slavin from WHYY wants to know if any of the asymptomatic inmates have started showing symptoms now that they were tested positive for COVID-19.
So the question was for our inmates who were asymptomatic and have tested positive, have any of them started to show symptoms? My last report was about 1 o'clock today, and as of that point, as far as they could tell, no one had started to show any symptoms. Is that it? Okay. Anything else? No? Okay. Great. We'll see you tomorrow then. Thank you.